Yes, so autoimmune diseases are the curse of our times, and we have to face this reality. So, I will start by explaining what are T lymphocytes and B lymphocytes. So, and the HLA complex, the human leukocyte antigen complex, because for proper understanding of the subject, there's a slight refreshment of these things. Then, what is autoimmunity? Why the autoimmunity occurs? The miasmatic assessment of autoimmune disorders, management strategies, certain animal experiments on immunology and homeopathy, autoimmune diseases in pregnancy, autoimmune diseases and cancer, which are two sides of the same coin, and lastly, common autoimmune diseases, a brief understanding, the homeopathic intervention, and of course, cases. So, this is what my outline is for the successive lectures. So, ladies and gentlemen, the concept of self and non-self. Every self, or what we in homeopathy, homeopaths refer to as vital force, has its own identity. That means our vital force has its own identity. A vital force needs its security and protects itself by all possible means. And that is why it is called autocratic, which we have learned in aphorism number 26. Vital force will negotiate with every other cell to participate in its needs. Immune system complex is a network of special cells and the organs that defend the body from noxious stimuli. Now, what is the immune identity? The immune identity, what we will see later on, is always in a fluid or a changeable form, because unless and until it is fluid, it cannot cope up with the dynamic interaction of internal and external stimuli along with the vital force. Now, any flaw in this immune identity, and the body loses its ability to tell the difference between self and non-self. And when this happens, the body makes autoantibodies that attack the normal cells by mistake, and which we call as autoimmune disease aid. So, friends, what the curse of leprosy was in the last centuries, in fact, for particularly 10 centuries or more, leprosy was actually a curse. The autoimmune diseases are the curse of this century. It's like artificial intelligence, AI, controlling the human beings. So humans actually developed artificial intelligence as servants. And suppose, I mean, the thought is frightening. Suppose AI starts controlling humans. I don't know, the day should not come. But then autoimmune diseases are taking away, are the order of the day now, particularly after COVID. So let us see what the T cells do. T cells have got several functions. Number one, T cells are special type of lymphocytes. So, moment the body is exposed to any noxious stimuli, the first reaction is an acute inflammation by the neutrophils. The second line of defense is the lymphocytes, that is the T cells and the B cells. So, the T cells are very important because they perform an important function of immune surveillance. So, they scan the entire body cells for foreign antigens. And whenever there is a foreign antigens, it is mandatory for them to mount an immune response with the help of B cells. So they order the B cells to generate antibodies. So without the T cells ordering the B cells, function of immunity will not be processed. So immune responses when the T cells order the B cells, and then the B cells produce the antibodies which ultimately eliminate the pathogens and direct the immune response. But not only that, the T cells are themselves capable when they're activated, because there are subsets of T cells, which when activated, they become cytotoxic themselves, and they kill the infected cells or cancerous cells. So they're called as NK cells or killer cells. Not only that, they have an anti-tumor response. That means by virtue, T cells will not allow cancers to occur. We will always also talk about autoimmune disease and cancer, but just in brief. So it is the T cells which control the body not to form cancer cells, or not let the cancer cells inside the body or the genes can oncogenes multiply. Plus, T cells have a memory called as immunological memory. So once they're exposed to any antigen, any foreign antigen, they store it in the memory. And suppose if whenever this particular antigen occurs and enters the body next time, they will be ready with an immune response. And last is, along with B cells and the other cells like macrophages and neutrophils, they help to achieve what is called as homeostasis. This is essentially the harmony of vital force one talks about in a force number 26. The vital force should be in harmonious equilibrium. This harmony equilibrium, this, my dear friends, is the T cells which are responsible, an important part they play in homeostasis. You remove the T cells and your homeostasis is shattered. Likewise, B cells, they are responsible for antibody production. There are different types of antibodies. We are not going to go in depth about that. But they produce antibodies. These antibodies are proteins that bind and neutralize any foreign substance, particularly foreign proteins. Second, B cells are important in initiating the T cell immune responses. That is, if the B cells are not there, then T cells by themselves cannot mount an effective immune response. So both T and B together are important in the entire immune process. A very important function of B cells is to present the antigen to T cells. So there are so many antigens lurking in the blood and everywhere in the tissues. Now, the B cells, they attach to the certain antigens and they take that near the T cells so that T cells is primed. So it is called as antigen presentation. If the B cells don't perform this function of antigen presentation to the T cells will never know, or they will miss those antigens and they will not be able to mount an immune response. As I told you in earlier about T cells, so T and B cells maintain the immune homeostasis. The two other functions are tertiary lymphoid tissue development. So the lymph glands which we have got, the lymph nodes which we have got, they are composed of B cells. And the enlargement, the lymph node enlargement, the responsible cell is the B cell. So T cells and B cells are important as cellular structures for immunity. Now let me talk about something called as now HLA or MHC. Now I'm not purposely not using the word MHC. Let's talk about human leukocyte antigen. Self-explanatory. HLA complex. So it is human, that is exclusively for human beings. Leukocyte means WBC and antigen is antigen. And it's a complex of antigen. What is it exactly? And why are we discussing it? Because this HLA complex is a set of genes which are present on the surface of all cells, all leukocytes, all WBCs, and that code for proteins that help the immune system distinguish between self and non-self. So practically every WBC contains this set of genes. And they are the root cause which decide the resistance or susceptibility of an organism. In homeopathy, we keep on talking about resistance and susceptibility in different forms. My dear friends, it is this genome or this genomic complex or HLA complex which decides the resistance or susceptibility of an organism to a particular environmental stimuli. So what does it do? What this actually HLA does? HLA also binds peptide means protein fragments from the pathogens. So that means they take away certain peptides or certain molecules from the pathogens and they display them on the cell surface. So they bring it, suppose it's, say a virus is inside a particular cell. So it is inside the cell. Now from the inside of the cell, the T cell which is outside will not know that certain virus is inside. So what this HLA complex does, it takes certain proteins from this virus inside the cell and presents it on the surface. So it binds the fragments of the pathogens and displays them on the cell surface so that the T cells recognize. And once the T cells recognize, then the cascade starts. The virus infected cells are immediately killed. Macrophage is activated. The macrophage, macro means big, and phage means cells which eat other cells. So macrophages are activated to kill the bacteria living in the intracellular vesicles, and the B cells are activated to produce antibodies that neutralize the extracellular pathogens. So B cells are responsible for neutralizing the extracellular pathogens, one, and intracellularly also the macrophages can kill them. So certain viruses which live inside the cell but they have escaped the killing mechanism, they're foreign in nature. Once this HLA presents them to T cells, the T cell orders the macrophages to kill that virus immediately because it is non-cell, it is not of the body. Now, suppose if the pathogen mutates, maybe it will be a virus, maybe it be bacteria, whatever. If the pathogen can mutate in such a way that it escapes the presentation by an MHC molecule, MHC is same as HLA. HLA, MHC are same. MHC full form is major histocompatibility complex, which is same as HLA. So, if the pathogen mutates in such a way that it escapes presentation by a HLA complex molecule or a MHC molecule, then there is a strong chance that it will survive. One of the very good example is HIV virus. Why can HIV? Because it mutates. Moment you, starts inside entering the particular cell, it starts mutating. Now, what is autoimmunity? Autoimmunity is nothing but the breakdown in the immune system's ability to maintain self-tolerance. So every organism tolerates. Like we all see, marriage. Marriage is what? A successful marriage is tolerance of the two partners. If the tolerance part is gone, see, no one is perfect. So no cell is perfect. There has to be harmony, and for harmony to be established, we need tolerance. So because every cell is different from each other in its antigenicity, in its functions, in its method of mostly same, but slight differences there. So each cell has to tolerate other cells as well. But when there's breakdown in the immune system's ability to maintain this self-tolerance, it results in an immune response which is directed against the self-components of the body, and this is called autoimmunity. And those symptom syndromes, which are caused by those autoantibodies or lymphocytes, and that which attacks the molecules, the cells, the tissues of the organism producing them, then they are called as, they develop into autoimmune diseases. So finally, all the mechanisms that cause abnormality of B or T cell activation, they result in autoimmunity. So this, in the early 90s, particularly in 1994, AIDS was due to HIV. And today we have pandemic of AIDS, and they are autoimmune diseases. At that time, AIDS was really feared. And today, autoimmune diseases, particularly after COVID, particularly after 2020 and 2021, we are seeing a massive rise of autoimmune disease. And that's the reason why in early 2025, I had to take this topic. So what are the actual cellular characteristics of autoimmune? AID means now, wherever the word AID will come, it is autoimmune disease. Okay. So what actually happens, how does it take place? So first and foremost, if there's a failure of recognition of self-antigens with the T cells. Now T cells is programmed, T cells programs other cells also to recognize self-antigens. If there's a failure, then you have an autoimmune disease. Second, breakdown of surveillance by T cells. So T cells is continuously surveying the entire body for identifying and nullifying the foreign antigens. So that surveillance system is gone. Third is cross-reactivity. There are so many viruses we'll see in detail, viruses, even non-viral peptides like proteins from bacteria, from fungus, from parasites, or certain proteins which are called prions. Now, I'm not going to go into description what prions are, but they can mimic antigens present in the human tissues. For example, uh, an antigen on HPV. HPV is human papilloma virus, and the insulin receptor. They are very similar to each other. So the T cells cannot recognize whether this insulin receptor antigen, which is mutated by the HPV and the HPV, which I mean they can't differentiate, and that is why they react to this insulin receptor, causing diabetes. So cross reactivity, viral, non-viral peptides or proteins, prions, they mimic the self antigen and induce autoimmunity. Now sometimes what happens is either inside the cell or outside the cell, certain proteins break down. So that is called sequestering of antigen. When the proteins break down, either the cell structure or whatever, or pathogen, now it is not a complete antigen. So when there is not a complete antigen, a small antigen is called sequestered antigen. Now these are attacked by antibodies because for the body, it is a separate antigen by itself. And what it causes? It causes antigen-antibody complex, which starts deposition. The sixth point, deposition of the antigen-antibody complex in tissues. So in certain diseases like SLE, where other organs are okay, but problem with SLE is there's a deposition of antigen and antibody complexes. Now, antigen-antibody complexes are formed in the blood, and they will start depositing kidney, causing another disease. They will start depositing the lungs, causing, so deposition again is a problem. There is a progressive, purposeless, selective cellular destruction. Like in cancer, it is progressive, purposeless, selective cellular multiplication. Here, there is progressive, purposeless. What purpose it serves, no one knows. But it is progressive, purposeless, selective cellular destruction. And that is a very, very important pathogenesis of autoimmune diseases. As I already said, there's deposition of antigen antibody complexes in the tissues. Normally, whenever antigen antibody complexes come together, they are destroyed and eliminated. But suppose if they're not destroyed, this body complex stays, then they have nothing, nowhere else to go, start depositing in certain places and develop so many diseases. Inappropriate MHC expression. Now, I told you in the last slide that this human leukocyte antigen or MHC, they bind to fragments from pathogens and display them on the surface for recognition of T cells. Now, suppose if they don't do the work properly, they don't display the thing properly, then the T cell will not be able to recognize. So, inappropriate MHC expressions, like in IDDM again, pancreatic beta cells express abnormally high levels of human HLA antigens. Now, why do they do that? No one knows. This why is a very big problem. But problem is that why can be answered in the next slide. And that answer is an active miasmatic state. Of course, I will go into depth about each miasm and their causation or their role in developing an AID. So the fundamental cause of any AID according to homeopathy is an active miasmatic state. And there are loads of exciting factors. One of the prime is influenza or sorry, viral. Now the recent epidemic, chikungunya epidemic, which we have in Nagpur had, so for the first time we have seen cases chikungunya presenting very, very varied manner. At least I have seen 6 to 7 myocarditis patients and MI patients fresh. I mean, they had no problems at all. But that chikungunya, and after 6 to 7 days or a week or 10 days of after chikungunya, they are having MI. Now, there was no cause. They had no prior history of hypertension, diabetes, or something. Now, this I don't know how many papers are published. I've yet to read them. But then this was my observation. Chikungunya, hepatitis virus, hepatitis B, C, and D, then HSV, herpes simplex virus, Coxsackie B virus, rota, influenza, measles, mumps, rubella, Epstein-Barr virus, EBV, they are all potent enough to excite the formation of an AID. Not only virus, they can have bacteria like gonorrhea. For years together, for generations together, in homeopathy, we have been reading suppressed gonorrheal discharges, suppressed gonorrhea. The gonorrhea, don't take it as a disease, but it was a psychotic miasm. And the basic instigating factor of that, the bacteria, the cocci carrying this psychotic trend was gonococci. Likewise, enterococcus G and bacteroids, they are gut bacteria. When they, otherwise they are, no problems over them. But when they mutate and when they show their true colors, then you can have an AID. And here comes the role of bowel nosodes, which we are going to discuss later on. How bowel nosodes can help in treating this autoimmune disease. So enterococcus and bacteroids. Then we have got Clostridium, a bacteria called Clostridium, not Clostridium belchi, but another strain of Clostridium, which causes an AID called as a rare disease called neuromyelitis optica. The common Staphylococcus aureus, which is MRSA, it is implicated in SLE. And an oral bacteria again, which is Porphyromonas G, it is implicated in instigating rheumatoid arthritis. Now, these names are not important, but I'm just telling you those names. Fungus. So it's not only virus or bacteria, but it's also the fungus. Certain fungi can instigate multiple sclerosis. MS here is multiple sclerosis, rheumatoid arthritis, SLE, or Alzheimer's. Certain parasites, Plasmodium, Leishmania, worms, vermidiathesis. So here comes the importance of treating the vermidiathesis. A person who has got AIDs already, established diagnosis, why can't we treat the worms also? They could have instigated, we don't know, roundworms, flatworms, tapeworms, flukes. Now, since we are talking about organisms, it's not only human organisms, even in animals, AIDs are quite common. Pets, so flukes. And again, hygiene comes into view. So when we're treating AIDs, this worms and malaria and leishmania, they need to be taken. I mean, nowadays we find very less cases of malaria. No, the cases we taken by chikungunya and dengue. Yet, malaria is a very, very common feature in so many other countries. But then worms, even in affluent families, even in good families, worms are there. And one needs to, I have to emphasize that you have to treat vermidiathesis as soon as possible. That does not mean treating worms only. I'm asking you to treat vermidiathesis. Then, as we all know, and whenever I deal with a patient, you will come to know how I deal with a patient. We always ask for emotions, the cause. And invariably, in at least 90% of patients, we do find an emotional cause. Either a shock, ailments after a shock, ailments after grief. So all my, I have seen a lot of my students attending this seminar, people who have attended my lectures previously, and my clinics, as well as our school, NHI schools. I see them. So all of you are aware that when I take my history, I have a great emphasis on these ailments from, because I believe that all diseases are invited. Unless you invite a disease, give it place in your body to live, they cannot live. So emotions are important, and we have rubrics right away, and we have remedies right away. So emotions like shock can be grief, insult, joy, reprimand, failure, rudeness of others, like carcinosis. Just by others being rude to him or her, they can start developing a disease, and it can turn into autoimmune disease or suppression of all these emotions. long-term suppression or short-term suppression. Vaccination. Now, when you type Google whether COVID-19, I'm talking about COVID-19 because it's a particularly recent vaccine. COVID-19, does it instigate AIDs? Majority of answers are no. But the first response, the first Google is yes. And the three diseases they have mentioned is acute glomerulonephritis, AGN is acute glomerulonephritis, rheumatoid arthritis, and hepatitis. So, of course, other vaccinations are there. We are not going to go into depth. But in recent COVID-19, at least we have seen, we may be wrong or right, I don't know, but it's our observation consistently since 2022, 23, and now 24 is over. 25 we are beginning. We have seen a lot of cases, and we can directly correlate second dose of vaccine, and after 3 to 4 months, ABCD disease has been diagnosed. Graves' disease or hypothyroidism, Hashimoto's thyroiditis, different names. So there was and we'll tell you how to nullify this. I mean, how to take this history into consideration and tackle the disease. Then surgery. Certain surgery or fall or injury can instigate and can be an exciting factor for GBS, Guillain-Barré syndrome or Guillain-Barré syndrome, you want to call it, or SLE, or different types of rheumatisms. Rheumatoid arthritis is just one type of rheumatism, and they've got so many polyarthritis, nodules, and different names. We'll come to that in later on. So, any fall or injury and surgery can instigate rheumatisms, and I'm tempted to, tell you about my first cured case. Normally, I don't. Whenever I deal with a AID, I don't say they can cure it. You can manage it, but can't cure. And this is a case which is cured. So this 8 years old boy had come to me, and he was extremely, bloated up when he had come to me. And what had happened was, now about 8 months ago. So this 8 years old boy coming to me, this is a 10 years old or 11 years, I don't know how many years ago. He came to me, and 8 months ago, before coming to me, he had hernia, inguinal hernia. Okay, fine, you have an inguinal hernia. So his parents took him for surgery. Now this boy belongs to Chandrapur. Chandrapur is a place near Nagpur. Surgery was over, and one day after surgery, the boy started complaining of pain in the legs, then pain everywhere. So they thought, okay, the anesthetic effect is over. So they kept on giving painkillers, and then he was discharged, and the pain started continuously developing. Not only the pain developed, he started having pain only on touch. He was taken to a pediatrician. The pediatrician referred to a rheumatologist, and the rheumatologist ultimately diagnosed as dermatomyositis. Derma means skin, myo means muscle, and itis means inflammation of the skin and the muscle together. Now, anyway, he was in great agony. He was given painkillers. He was given steroids, and continued for 8 months. But there was hardly any relief of pain. The poor boy was so much in agony, he could not sit. When he was to sit, then the muscles of the buttocks used to press and he used to have pain. When he used to lie down, the entire back used to be, and the legs were on the bed and he used to pain. So wherever he was being touched, so how was he going to survive? That was actually the state. And he was somehow pulling on. No, he could not go to school and all. He came to me now. First and foremost, I gave him arnica and no results. Ruta, better, no results. Ultimately, I had to increase the potency to CM. He was not responding with any other potency. And it's hardly ever I repeat so much of CM in a patient, but then he was not responding to any other drug. So the only relief he was getting was from Ruta CM. Anyway, so it took us about a month to settle down, and infrequent doses of Ruta CM. And after settling down, I gradually asked him to reduce the steroids. Again, it took us a year or so to reduce steroids. Till that time, in between, pain was there. So sometimes Ruta, sometimes Rustox, sometimes other drugs which were indicated. We did not give him anything else. Now, when he was substantially this was out, this steroid was out. It was time for me to give something realistic. So it took me about I would say 7 to 8 months to withdraw steroids, and then he was in a state where he used to get pain, but bearable pain. Now, what should I take the ailment from? Ailment from surgery or ailment from anesthesia? That was my question. Because both were there. Without anesthesia, you can't give surgery. And we have got specific drugs. Ailments after anesthesia is acetic acid, and ailments after surgery is staphylococcus. So which to give? So I said, let's start with staphylococcus. So we gave him staphylococcus and gave him staphylococcus 1 m first dose, second dose, third dose. I don't know what to expect after giving that. But I was waiting for. I could not decide any constitutional drug or any drugs to decide upon. So I gave him staphylococcus and let it continue. Then SL. And after 2 months, I retook the history. He got a full-fledged drug. Calcarea Phos was his original drug. And we started in Kent's octave scale. Sa, re, ga, ma, pa, dha, ni. That is 30, 200, 1M, 10M, 50M, CM. That is how we give homeopathic medicines in, like I give homeopathic medicines in this AIDs. And after another year, he is completely well. He stayed with me for another 8 years. He was 16 years. He passed his 10th standard examination very well. And now he is a film director. So I'm so happy. And all these now he doesn't stay in Chandrapur. He is living in Mumbai. When he visits me, I always remind him. And in spite of reminding him not to take this vaccine, he had taken still, but nothing has happened. So this was a case which is very close to my heart. Now, there are certain drugs, NSAIDs, recurrent taking of NSAIDs, or certain hormones, or anti-malarial drugs, particularly this quinidine. Quinidine can instigate SLE. And antihypertensives. Otherwise, antihypertensives are so safe. But there are certain drugs like procainamide or hydralazine, alpha-methyl dopa. They can cause either SLE or instigate hepatitis, autoimmune hepatitis. Then there's an antibiotic for UTI called nitrofurantoin or minocycline. They also can instigate hepatitis. Not simple hepatitis, autoimmune hepatitis. Anti-TB drug INH. INH can instigate SLE. And today itself we had a case. Today or yesterday? SLE case? Yesterday. Yesterday we had a case of SLE. And she had a past history of tuberculosis. And there was a strong correlation. She had tuberculosis. She was given this AKT4. And after 3 to 4 months or 5 months, she started developing features of polyarthritis. So, close correlation, possibly, we don't know, we are not sure, but that INH of that AKT4 could have instigated SLE. Otherwise, there was no reason for SLE to start. Then, certain exposure to certain chemicals, radiation, abnormal pressure. The abnormal pressure means deep sea diving or going up when the mountains top. Certain people, certain constitutions can't bear. So once you have climbed up the mountain, that's okay. Then once you start coming down, then you start having ABCD symptoms, and ultimately, when you're actually reaching your home, then you're diagnosed with ABCD, autoimmune disease, which could be. That does not. I'm not telling you not to do, but then there are certain AIDs which have shown the instigation from these abnormal pressures. Sudden change of habitat and climate. That again is a very, very common feature. We neglect it very often because nowadays the entire globe has become one family, and transfers of are not very, very infrequent, not only among cities in the same country, but different countries as well. So certain people who have always lived their half of their lives in very hot climate are suddenly now posted in a very cold climate, snow climate. Possibly that change and can develop. I have a case who has developed. I mean, this gentleman is basically from Punjab, and for a certain reason, he is now posted yeah, he's gone into to Seattle. So Punjab, the weather is very dry and it is cold in cold weather, but not as cold as Seattle. And after hardly 1 or 2 months of Seattle, he started developing breathlessness and so they could not understand. So they thought that he's adjusting himself, and very soon he was diagnosed with an autoimmune disease of the lungs. So it is not enough only for the fundamental cause to be there. It is not enough for exciting factor also. What we in aphorism number 7 call it causa occasionalis. But we also need a maintaining factor. So I always compare, when I teach my students, I always compare AIDS or any disease as a candle. A candle with a wick has the power to be lit. So it is there. Now, once an exciting factor or the matchstick is lit, so then it can light the candle. But the candle would need, I mean, the flame needs oxygen as well as the wax. If the wax is gone, then the flame will blow out. If oxygen is not there, the flame will blow out. Same goes with any diseases which are there, be it autoimmune disease, be it cancer, etc., irrespective of the name. So we need to have a maintaining factor. Those maintaining factor are the oxygen which continues the disease once it has been excited, or is the wax which continues the disease once they have been excited. The first and foremost maintaining factor, which is quite common in most of the AIDs, are long-term emotional and physical stress. And we have got loads of drugs, be it argentum nitricum, be it causticum, be it natrium long-term emotional or physical stress, nitric acid. Second very, very important thing is no purposeful occupation. And this is a very, very common. That's why every patient which I meet, I make them work. Work in the sense, go to actual work, go to earn money. It's not going for earning money only. It's actually ridding yourself from emptiness. There are again, I mean, autoimmune diseases are generally seen in the younger age group 16, 17, 18, 19, 30, 35, 40. But nowadays, we are seeing in older age groups after 63, 64. So the normal retirement age in India for most of the jobs is between 60 to 61 or 62. And certain people who have taken voluntary retirement, say at the age of 40, 41, 42, they have started showing till they were there in the job. The job was very hectic. Many people used to consume alcohol, cigarettes, this, that, but nothing used to happen. After retirement, 1 year, 2 years, and 3 years, and you start having some of the diseases together. Normally, the metabolic disease like diabetes and hypertension, but many come with AIDs as well. So you should have a purposeful occupation, and that is an important criteria to rehabilitate or treat these patients of AIDs. If there's no purposeful occupation, it becomes a maintaining factor for AIDs to continue. In India, we are lucky, but I have lots and lots of patients throughout the world who lack support system, particularly Indians residing abroad. In India, we still have this concept of family. Like I personally stay with my parents. So we have a family support system. If something happens to me, my family is there for me. Not my only immediate family, my wife and children, plus my parents. So this family system is still prevalent in India and the Indian subcontinent mostly, but it is soon fading away in the rest of the world. The moment the child turns 15, 16, 17 years, they leave the house for whatever purpose and they never return home. So the parents are living separately, the children are living separately, and then you have to depend only on friends who may show up, may not show up. And again, it's your nature if you can befriend people or not. Many introverts, like Natrium muraticums, they can't befriend people, so they can't ask for help. So they are always alone. The lack of support system at home or at work, because every work involves some sort of politics. If you are in a job, particularly, there has to be some politics here and there. So you need your own group of people to support you, both mentally and physically. Physically means take a housewife who is a working woman. So now it becomes a two-time housewife itself. A homemaker itself is a full-time job, plus you are working outside and you're not getting any physical help. This itself is a maintaining factor for an AID to continue. So lack of support system, either in home or work, either mentally or physical, it's a very, very important maintaining factor, and that needs to be addressed whenever you are treating any case of AID. Loneliness. Yes, loneliness has always been there with all organisms, not only in India, in human beings, but every animals as well. If there's loneliness or no friends, or there's no source of emotional ventilation, like if I have a problem, if I can't speak to someone else, then I start creating a disease. The emotional ventilation is a very, very important thing, and you can't keep on ventilating out to any Tom, Dick, and Harry. You need certain friends for that who are trustworthy, and not all drugs are capable of making such friends. We may have lots of acquaintances, that's one thing, but actual friends are less. Diet. So the other system of medicine, they concentrate mainly, they neglect the other four, upper four, which according to homeopaths are more important than the lower four. Diet. Particularly, people have observed gluten, and yes, even I observe gluten, milk, refined sugar, processed meat, deep frieds. Like in India, we do have all that Western pastas and deep fried this what is it called, French fries and burgers and this and that. They're not basically Indian diet, but at the same time, samosas and bhajias and all which are they also deep frieds. Tomatoes. People, you'll be surprised. Many people have, many AIDs, their continuance are because of tomatoes or brinjal. Certain nuts like pista and cashew, instant coffee, alcohol, and chocolates. And I'm talking about milk chocolates, not dark chocolates. So these are few of these diets which need to be withdrawn, and we'll be telling you how to do that. Lack of exposure to sunlight, and even in nature. There are so many people who are totally imprisoned in their own cell, in their own offices, in their own home. And even if they go outside, they're completely covered. We are lucky in India where we have got lots and lots of sunlight, but then again, we are totally covered when you go in the sun. We don't want to be tanned. And sunlight, my dear friends, is a very, very important healer by itself. Same way with nature. We only just go for party, for picnics and all to some natural places. And there also, we are busy seeing the different monuments and this and the natural beauty, but we don't enjoy. I'm talking about myself, which I have lately realized. Like when we go for on vacation, we go to so many beautiful places, but then we never enjoy one place in completely and complete entirety. We go to a place like Switzerland, we have to 10 things to cover. Day 1, day 2, day 3, day 10, and itinerary there. So that toot na jaye. We should not leave that when we have come to Switzerland. So we should see every small thing. But at the same time, we are missing out the actual natural beauty and the peace, which is important for. This is the reason why we actually had gone for vacation. So that's there. And of course, smoking. Now, there's a very thin line when one smokes for pleasure and the tobacco starts smoking in you. The tobacco is like same. You drink alcohol and alcohol starts drinking you. So same way with smoking. And smoking is a very, very important factor for vasculitis, which is a very important, uh, pathology in most of the AIDs. Vasculitis, that is, the vessels are inflamed, particularly SLE. So smoking needs to be stopped, and once stopped, then it should not be done again. Now let's discuss autoimmune diseases and its miasmatic assessment. So as homeopaths, we need to know which phase of this autoimmune diseases the patient has come on. If we don't know this, then we will declare all autoimmune diseases as incurable. We'll never be able to attempt any curative process in any autoimmune disease. That's why, as homeopaths, it's imperative that we don't go by names. Like, I'm not worried about only knowing SLE or rheumatoid arthritis. Like, rheumatoid arthritis is such a weird thing. You can have seropositive and seronegative also. So the name does not matter. It only is just because you have to give a name. That's why we give a name. What matters to me is this diseased individual has come in which phase of miasm. So that if it is in the psoric phase, then I will be able to cure. If it's in the tubercular phase, I still attempt to cure. But if it's in a psychotic or syphilitic phase, then I'll only manage the case or somehow try to heal, but will not aim for cure. So, what is psoric phase? Almost all AIDs present initially functional symptoms like sensations, pains, etc., without any structural changes. Now, this phase can last for months or years, and it depends upon the activity of the autoimmune immunity and the host response. Both are important. So, if your host is good, if your resistance and susceptibility is good, then the autoimmune activity will be there, but will be less. Here, the blood investigations may or may not be positive. Only the clinical scenario may be there. Like example, psoriatic rheumatism. Psoriatic rheumatism, like rheumatoid arthritis or any rheumatisms, different names, polyarthritis rheumatica, and then dermatomyositis, ABCD, the names can change. They can start with sudden, severe, self-limiting, violent, functional, acute inflammation. So the top, if they're exposed to certain viruses and the molecular mimicry takes place, then you can have a bout of sudden, severe, self-limiting, violent state of acute inflammation. And if you ask that person, you can have that they can have a symptom, past history of skin disorders or suppressed foot sweat and blood. Sorry, foot sweat. And the blood investigations may show polymorphonucleosides, and the serology may or may not be positive, like investigation like ANA or dsDNA. They may or may not come, but ESR will be high. Or more than ESR, CRP will be high. C-reactive protein will be high. Because it's an acute phase of protein, ESR will be slightly raised. So this is a psoriatic phase. So if a rheumatoid arthritis patient or some other disease comes with this, I can actually attempt to cure if I've been able to diagnose that case. But not necessary. Someone can come with a tubercular phase of that same disease, either sauropsychotic, saurosyphilitic, or sauropsychosyphilitic. And here the complaints will be erratic. Sometimes in this joint, sometimes that joint. Recurrent, periodic, fluctuating in intensity, and along with it, hypersensitive response, emotional response of the patient. Like the inflammation will be a little bit, but the expression will be too much. I've got excessive pain. Now, who's going to assess that excessive pain? But then this is both in psoriatic phase as well as tubercular phase. Hypersensitivity to emotional response is too high. All AIDs beginning as acute diseases but heading towards destruction are indicative of tubercular miasm. And the most classic example of a pure tubercular phase rheumatic heart disease, autoimmune disease, rheumatic heart disease. Rheumatic heart disease starts with the sore throat, and sore throat means high grade fever with sore throat, redness, tonsillitis, and then it licks the joint. That means very soon, when the fever subsides or is recurrently suppressed, then you will have erratic joint pains, the shifting type of joint pains. We are going to see, of course, in detail. And then after that, even if the joint pains are taken care of, then finally settles down in the heart, which we call as rheumatic heart disease in the form of mitral stenosis or aortic stenosis or whichever valvular stenosis, or it can still settle down in the kidneys by another name we call as Bright's disease in the Kentian times, and today we call it as acute glomerulonephritis with different names, FSGN and MSG, etc., etc. So we are not going to go in that. We'll talk about it later. So this is a classical tubercular phase reaction, and this phase again gives us a chance. Rheumatic heart disease, we should attempt for cure in early stages because it is curable. My first case of treating a heart disease again was a rheumatic heart disease patient, and he's cured. And I'm so happy when today he's a lecturer. He's a father of two special children. So then psychosis. Most, if not all, AIDs directly start as psychotic. It's a constitutional state of uncontrolled, causeless, useless, progressive cellular multiplication. So it has to be uncontrolled. So it cannot be controlled by the body. Causeless, it does not serve any purpose. It should be progressive and should be cellular multiplication or functional disturbance. It's not only cellular multiplication, but even a progressive, causeless functional disturbance is called psychotic miasm. The problems of immunity, the RE system, the reticuloendothelial system, like these problems of surveillance or problems of recognition by the T cells, confusion of identity of self and non-self, they are highly indicative of psychotic miasm. Rheumatoid arthritis has a slow and gradual development with or without restriction of mobility and no sclerosis in the joint. Ankylosing spondylitis is a classical example of a pure psychotic disorder, sauropsychotic or psychotic disorder. And then we have syphilitic miasm, which is again an evolved miasm with an advanced irreversible pathology, which is always destructive, self-destructive in nature. Vitiligo is self-destructive in nature. Now the patch has developed, so that cells, the melanocytes, they're dead. Now whatever you want to do, you keep on doing. So saurosyphilitic or syphilitic miasm. Certain diseases have evolved from SORA to tuberculosmiasm and to syphilis, like rheumatoid arthritis. You can have destruction of joints. We are going to see it later on. So gradual onset, continued suffering is there. The pains of the syphilitic miasm are always stitching or shooting type or lancerating type of pain, aggravated by heat, aggravated at night, aggravated by slightest of weather change, and ameliorated by cold in all respects. So the late stages of most of the disease, be it rheumatoid arthritis or SLE or different names, bony exostosis, arthropathy, the different names we call SLE, diabetes type 1, diabetes type 1, IDDM. We have total destruction of the cells of the pancreas, the beta islets of pancreas. So that's why you need a permanent insulin from outside. Osteomyelitis, pyoarthrosis, Charcot, different beautiful names. We are going to go in details. So they have self-destruction of syphilitic miasm. Then there is a drug miasm. And immunosuppressants are used for reducing the immune response in AIDs as well as organ transplants. Now, since we are talking about immunosuppressants, I am going to particularly tell you, because as practitioners, we have to know the names, whether we prescribe or not, and why shouldn't we can prescribe now in homeopathic form. The older immunosuppressant drugs were cyclosporine, tacrolimus, azathioprine, methotrexate, corticosteroids, and cyclophosphamide. Now, the drugs which are in dark, azathioprine, methotrexate, and cyclophosphamide, and rituximab, they are homeopathic drugs as well. So that means I've written them down. Potentize cyclophosphamide. How do you potentize? Potentize methotrexate, and same way with rituximab. I have tried with other drugs also, but then there was no space. So these two drugs I have tried. Take 1 pinch of cyclophosphamide, 10 drops of rectified spirit, plus 99 cc's of distilled water. Serial dilution, 1:10 decimal or 1:100 centesimal scale. Then, along with every dilution, we have to have succussion, 10 strokes. Now, I'm not going to go into mathematics of cyclophosphamide, methotrexate, and rituximab. But mind you, friends, these are homeopathic drugs which we have been using since not a very long time. But yes, they do help us in managing certain AIDs which are otherwise not amenable to our routine homeopathic medications. So, newer immunosuppressant drugs. Now, you may not, you can make they're extremely costly. So what I do is I ask my patient just to give them 1 drop, and then I only make those drugs. So then we have got sirolimus and tofacitinib, taclizumab. They have different difficult names for you to remember, but then there's a slide which you should know. I'll be a little bit faster. So these were the causes. Now let us see general symptoms. How do I recognize? How do I suspect that a person has got can have an AID? if there's a persistent general symptom like fatigue. Doctor, initially I used to walk 3 to 4 kilometers with ease, but nowadays I get fatigue very easily. And 90% of people are diagnosed today in urban world are diagnosed with chronic fatigue syndrome, CFS. They don't give rest to their bodies. Even while resting, they are on their mobile or they are watching something or they are reading. They do just don't sit free. Even if they're sleeping, they have tend to have so many dreams about tomorrow, and so they can't relax. So this is a starting point, a chronic fatigue. And then chronic muscle aches, like if you press here, and we call it cervical spondylosis, we call it so many different names, lumbar spondylosis. They're not, names are good, but ultimately muscle aches. And then we keep on finding whether we have got potassium deficiency and vitamin deficiency. I don't know. It is maybe a starting of AID. So fatigue, chronic fatigue, muscle aches, not fever, but feverishness. I feel the fever. When you put a thermometer, the thermometer is normal. This feeling is very constant. And it's a very, very proactive indicator that the person can have an AID. Initially, the same feeling was to occur in tuberculosis. So, hardly about a decade ago, if a patient was come to me, I would suspect tuberculosis. Even if it is not showing positive on that sputum and all, but these were features of tuberculosis. But now, in today's context, I would rather think of an AID rather than tuberculosis. So chronic fatigue, muscle aches, fever, and malaise. Again, malaise is loss of enthusiasm to work. I love my work, but since few months, I don't want to work. That enthusiasm is lost. So these are, and this continues for a long time. In fact, it continues throughout the AID, even in complication phase or in any phase. These four things continue plus minus. Then there are certain inflammation signs: redness, heat, pain, and swelling. So they are very general symptoms. When we come to certain autoimmune diseases, we'll talk about them individually. An autoimmune disorder may affect one or more organ, like blood vessels, connective tissue, endocrine glands, RBCs, and skin. And one person can have more than one autoimmune disease at the same time. That is also quite unique. So any autoimmune disease, what will do? It will cause destruction of one or more types of body tissue, either an abnormal growth of an organ, changes in the organ function altogether. Only these three things are possible. The organ offended, I'm not going to go in that. Certain lab investigations are important because we are physicians and we need to give a tag, a name to the condition which we are treating. We just can't say that this patient is a SORA and this is a psychotic patient as a vocabulary. So that's why we have to give a name. So complete blood count, ESR, C-reactive protein, RBC indices, hemoglobin, blood sugars, RA factor, DSD.